No matter what's going on, no matter how challenging things are, whether it's a pandemic or war or economic trouble, people still have babies. There's nothing like a baby to bring a little hope. The best studies that we have indicate that the virus does not get to the baby. Most mothers do very well. There are many women out there that are probably COVID positive that don't know it and go through labor and delivery uneventfully. There are reports of infants under a year being infected, but fortunately children and infants tend to have milder disease than adults do, particularly older adults. We're very cognizant of the importance of keeping things safe. So at Northwell, both the patients and the staff wear masks. We take the visitor's temperature every 12 hours, and we segregate them if there's any suspicion that they have COVID-19. Northwell has sent out to all of our offices an online prepared childbirth classes and breastfeeding classes. So that's the way people get their information. And aside from the fact that we have what they call social distancing, which I think I've read this, that people prefer to call it physical distancing and social closeness. So I think that's a better way to look at it. What moms have to do really is to understand that things might not be exactly as they anticipated. But what they can expect is that they're going to be safe and their baby's going to be safe. You still see a mother and a baby waiting to get picked up and leave the hospital. And those are the stories, I think, that moms have to hear. I think moms have to talk to other moms and know, you know what? I went in, I had a baby, everything's great, I love my baby. A little different than I expected, but I got my baby. For general questions that moms might have, like, will I be separated from my baby? Can my husband or my significant other be with me? Will I be able to breastfeed? When will I go home? Most important thing to do is to stay positive. I think the news is focusing on understandably, on the really, really sick patients. That's the tip of the iceberg. And there's a gigantic iceberg under the water that we can't see because we haven't had the testing, and most of those women and patients and their babies do very, very well. And probably the question that I get asked a lot, and you see on the news all the time, is when will this end? How long will it last? I don't know when it's going to end. I don't know how long it's going to last. But I know this. Today we're one day closer. So that's what I would tell the patients, and that's what I tell everybody, my staff and my family. We're one day closer.